Good afternoon and welcome to everyone to the 7th episode of Bedrocan Series. Today we have a very special guest, well known in the field of cannabis-based medicine. And welcome Professor Kirsten Müller-Vahl.
Hello, thank you for having me.
Thank you. And today we're going to talk about the effects of cannabis-based medicines on tics and Tourette. Professor Müller-Vahl will share some of her latest research, which was not published yet. So we'll have some first-hand insights into these novel studies. But first, let's have a really shortly about the house rules. So the webinar will last for around half an hour. If you have any questions during the webinar, use the Q&A section. And in the end, we have a separate time for a Q&A session. And we will try to answer all of your questions. And of course, what is really important for us is to know our audience. So you will see a poll just coming up here in a video. So please just cast your votes. It should appear soon, just a few seconds. Yes, so the first question, how would you describe your knowledge level of cannabis-based medicine? So just point out one, if it's like expert, you're expert, or have your average knowledge, and we will have a look at it. And the second question you can see it is, what is your connection to the cannabis-based medicine? Are you a healthcare professional, or you are a researcher or a patient? So we'll give you a few seconds and then we can announce the results. Okay, we already have our results. So it's 50% is above average knowledge. This, I think it's great. And we have 38% of experts. So welcome, of course, that's always good to have experts on the poll. And from who are we having here? It's mostly 63% it's business. Then we have 25% patients and others. So also if you can also tell us who's others, just for our curiosity. And yeah, well, thank you for voting and welcome to this seminar. And Professor Müller-Vahl, you are a professor of psychiatry at the Department of Psychiatry, Social Psychiatry and Psychotherapy at Hanover Medical School in Germany. And you are a specialist in both neurology and adult psychiatry. And also you are a head of a Tourette outpatient clinic in the first chairperson of the International Association of Cannabinoid Medicine. Before we dive into our main topic today, could you please tell us a little bit more about yourself and your background?
Yes, so thank you very much for this kind of introduction. As you already mentioned, I'm a medical doctor, so I see patients, I treat patients, and I'm specialized in tic disorders and Tourette syndrome. And besides my clinical work, I'm a researcher, or better to say, a clinician scientist. So I'm not working in a lab, but I do a lot of research in patients suffering from tic disorders and Tourette syndrome. And the main focus is, besides underlying pathology, in the treatment and care of patients with tic disorders.
So basically your main treating patients with Tourette and tics, and maybe just for our audience, could you tell us a little bit more what is Tourette and how does it affect daily life of your patients?
Yes, so Tourette syndrome is a tic disorder, or more specifically, it's a chronic combined motor and vocal tic disorder. So in other words, all the patients who suffer from Tourette's suffer from multiple motor and at least one vocal tic. Per definition, these tics must last longer than 1 year, and per definition, tics must start in childhood or adolescence. So this is not a disease that can affect adults. What is not included in the definition, but what's very important in clinical care, is that 80 to 90% of our patients suffer in addition from psychiatric comorbidities. They may influence their quality of life more than the tics, but this is depends from case to case. And we see in our patients comorbid ADHD, OCD, depression, anxiety, sleeping problems, rage attacks. So it's a huge spectrum of different symptoms that may occur in patients suffering from Tourette's. And this, of course, may influence their quality of life.
Of course, yeah. And would you say that tics are psychiatric or more like a neurological problem?
So I would say Tourette syndrome is at the border between psychiatry and neurology, but tics are per definition a movement disorder. So I would say the tic more belongs to the neurology, but all the comorbidities, of course, they belong to the psychiatry. And this is also reflected in centers caring for patients suffering from Tourette's. So some of my colleagues are neurologists, other are psychiatrists, and both is fine.
Of course, that's really interesting, actually. And you also mentioned that you started treating your patients with cannabis more than actually 20 years ago. Maybe can you share how that started and how you firstly encountered with cannabis at that time?
Yeah. So it's really a long time ago that we became interested in cannabis-based treatment in our patients. And it started from the clinics. So Tourette's is until today a clinical diagnosis, and therefore you must investigate the patients. And in addition, you must take a history and you must ask very specific questions. What influences the tics? Is there a premonitory urge? Can the patient suppress their tics? And all this information is important to make the correct diagnosis and to see which symptoms exist in your patient. And while asking all these different questions, I received from an increasing number of patients the answer that use of cannabis is helpful for their tics, and not only for the tics, but also for some of the comorbidities. And because I heard this again and again, I started to become interested in this and thought this is not only by chance. And therefore we started with a survey and asked actively all the patients coming here into our outpatient department whether they ever have used cannabis and what effects they experienced. And it was quite astonishing because what we learned from this survey more than 20 years ago, that a quite large number of patients already had used cannabis. Most of them did not report about this actively because at that time it was illegal, of course, in Germany. And about 80 to 90% of these patients reported indeed that cannabis use was helpful for their Tourette syndrome.
So you were a pioneer in this field of treatment tics with cannabis. And maybe can you share also how you see how this evolved during the years, how it was in the beginning, and if you compare it now?
So when we started this kind of research in the literature, there were only 2 case reports, one describing one single patient and another one describing 3 patients. And this was completely in line with our observation. In these case reports, beneficial effects of use of cannabis, smoked cannabis, were reported. And after we received these answers in the survey from our patients and found that this might be a new treatment strategy for patients suffering from Tourette's, we started to treat one single patient with pure THC. At that time, it was the only cannabis-based treatment that was available here in Germany and could be used for this kind of research. And after this patient reported a marked effect, and we could see while using THC, his tics dramatically decreased, we initiated a first clinical study. And at that time, we were very careful and we were very, we feared that this might induce some severe side effects because we all had no experience with cannabis-based treatment, and therefore we decided for a first single-dose trial. So in other words, patients received one single dose of THC, only a small dosage, and we observed our patients and looked for clinical effects. And this was a first controlled trial, placebo-controlled trial, and this was positive. And thereafter, we decided for a larger clinical trial, but large means we included 24 patients, but we treated them for 6 weeks. Again, we used pure THC, and the outcome was, again, a significant tic reduction. And then it took a while, but about 5 years ago, we initiated the first large randomized controlled trial. This is now completed. And in this trial, 97 patients were included, all patients with Tourette syndrome. We decided to use a cannabis extract. The extract is named nabiximol, so better known as Sativex. And the reason why we decided specifically for this drug is that at that time, this was the only cannabis-based treatment that was officially licensed here in Germany. And this makes it easier to initiate a controlled clinical trial. Mm-hmm. And the results are now there, not published yet, but we have the results. Unfortunately, we narrowly missed our primary endpoint, but we saw a strong trend for an improvement. And in 2 subgroups, we found a significant result. And this is interesting because this was in a subgroup of male and in a subgroup of those patients suffering from comorbid ADHD. And this is clinically important because tics and Tourette syndrome is more common in male compared to female. And as mentioned in the beginning, ADHD is a common comorbidity. And in addition, and this is what we always do in this kind of research, we look at so-called secondary endpoints, and a large number of these secondary endpoints were indeed positive. So we found significant results. This was true in assessments, self-assessments for tics, video assessments for tics, and assessments for depression and for quality of life. So taking this together and making a long story short, I would say, although we missed our primary endpoint, we were able to demonstrate clear efficacy of nabiximols in the treatment of tics and Tourette syndrome.
Mm-hmm. That's a I think, really interesting study, and really important also for our further research as well, to know what could be done actually with cannabis for Tourette and tics. And like what you also notice from the comparing the side effects from the cannabis-based medicine comparing to the neuroleptics, which usually are prescribed, right, for the tics. If you would compare like how patients actually felt after the treatment, and yeah, just maybe a little bit more about that.
So currently, of course, we do not have a study comparing the effects of neuroleptics and cannabis-based treatment, and therefore we also have no data comparing side effects. But based on my clinical experience, I would say in general and overall, cannabis-based treatment is better tolerated compared to neuroleptic drugs. And this is the main problem with this class of substances, because neuroleptic drugs are effective in tic reduction. So on average, we say to our patients, you can expect a tic reduction of about 50%. But the problem are the side effects, and most patients stop medication with these substances because of the side effects. And the situation currently in Germany is that in most cases, cannabis-based medicine is used when other substances, including neuroleptic drugs, are not effective or not well tolerated. So this is a difficult situation for a new treatment, because it can be used only at the end of the treatment, not at first-line treatment. And therefore, most of the patients have experience with neuroleptic drugs, and most of the patients report that cannabis-based medicine is much better tolerated and has less side effects compared to neuroleptic drugs.
Of course, yeah. Well, that's a really big thing, I think, for a patient as well, to have some treatment that have less side effects and also improve the quality of life, which is most important part of all the treatment, of course. And like from your clinical experience, what kind of cannabis-based medicine your patients are using? Is it like a flower form, or is it extracts mostly? Just a little bit maybe on that you can tell us.
So we use the whole spectrum, and it of course also depends on availability. So as mentioned before, in the beginning we started with pure THC because nothing else was available. Since 2011, in Germany, Sativex, nabiximols can be prescribed. And thereafter, we received the chance to use cannabis flowers, although we were not able to prescribe them until the cannabis law was active here in Germany. It was in 2017. And now we are allowed to prescribe the whole spectrum cannabis extracts, including nabiximols, pure THC, also CBD, and cannabis flowers. So I like to motivate my patients to try different cannabis-based treatments so that they are able to compare the effects of the different substances. And this is how I can learn what is most effective and best tolerated. And indeed, most of my patients prefer inhalation of cannabis flowers. And the reason for this is that they report it can be better dosed. It's more effective, and because it can be better dosed, they can avoid side effects.
Mm-hmm. And you mentioned that it's being inhaled. Is it like just for our audience to also understand? So it's not smoking, it's using special inhalers, right?
Yeah, this is at least what we recommend.
Mm-hmm.
But of course, there are patients who smoke cannabis. But as a medical doctor, of course, I recommend using a vaporizer. Some patients started using cannabis recreationally and by chance detected that it also helps for the Tourette syndrome. And when someone is used to smoke for quite a long time, it's not so easy to educate him to change the route of administration. But of course, as a medical doctor, I always recommend vaporizing. And based on the data we have, this is not only more healthy, but it's also more effective compared to smoking.
Of course, and also inhaling, it also works faster for patients, and we can also titrate the dose better, if I understood it correctly, right?
Yeah, this is compared to oral medication. So we all know this is completely independent from the indication. When you inhale cannabis-based medicine, then the effect starts within a few minutes, 5 to 10 minutes or so. The effect is much stronger compared to oral medication. But there, of course, are indications where you should prefer oral medication and where you don't want to have this strong effect within a few minutes. So it depends a little bit on the indication, and it also depends on what patients' needs are.
Of course. And mostly you are treating adult patients, or you also have kids as well?
Yes, so all the studies I've mentioned were done in adults. This is also what we mainly do in our clinical routine work, but indeed we treated some minors. The youngest boy was 9 years old when we initiated the cannabis-based treatment. So these children and adolescents we treated so far were either very severely affected. Most of them had a lot of psychiatric comorbidities, and all of them had been treated with other treatments, and they found to be ineffective or not well tolerated. And together with the parents, we decided for cannabis-based treatment. So this is done currently only in rare cases, but the cases where we decided to do so, we found very beneficial treatment effects. And now we have a follow-up in 2 minors where we used cannabis-based medicine now for 4 to 5 years. And they still use this kind of treatment. They have a very good development. They go to school, are good at school, and we see that their tics and their psychiatric symptoms improved significantly. But there's not much experience in minors. And so my rule is, besides these single cases, I think first we should make clear that cannabis-based medicine is really effective and well tolerated in adults. And thereafter, we should start to investigate efficacy and safety in children. But this will start because we do not have so many good treatments for our patients.
Of course, yeah, that's exactly what you do with the research that you mentioned with, for example, nabiximol. You had actually 97 patients with Tourette. That's quite a large number for such a study. And just like I didn't ask you before, just maybe for also our audience, you can tell a little bit more what is nabiximol in case our audience didn't know. Just that.
So it's a cannabis extract. Nabiximol is a cannabis extract. Here in Germany, it's the only product that is officially licensed. And it's a balanced product. It's standardized for the content of THC and CBD, and the ratio is 1:1. So it's currently here in Germany, it's the only officially licensed product and cannabis extract. But we have a lot of other cannabis extracts that can also be prescribed here in Germany.
Of course, comparing to when you started and now, of course, you have a bigger choices of what can be prescribed. Of course, it's still not a first-line treatment, but at least you have more options for your patients. And I think you also mentioned there was one more study, also a big study. It's like online survey performed by ICM, where you had look at cannabis flowers, mainly, only on cannabis flowers. So maybe you could tell also a little bit more about this study.
Yeah. So this study was a cooperation between my clinic and the IICM, and the main goal of this study was to identify whether there's a specific cannabis flower that is most effective in one specific medical condition. So we have so many different flowers that can be used and prescribed. We have so many different flowers with different ingredients, and of course we have flowers with different contents of THC and CBD. And we learn from our patients what flowers they prefer, but there's no conclusion about this currently. And therefore, we felt it would be a good idea to make a survey among patients who use cannabis flowers here in Germany. And we asked only those patients to participate in this survey who received cannabis flowers by prescription from a medical doctor. So we asked patients not to participate when they use a kind of a self-medication. So using our networks, more than 1,000 patients participated in this study. Non-surprisingly, they indicated that they use cannabis flowers for a huge spectrum of different diseases, including pain, including neurological diseases, psychiatric diseases, including ADHD and Tourette's, of course, but also other and even rare diseases were indicated as indication for cannabis-based treatment. The main results of this study were, first, the majority of patients reported that cannabis flowers significantly improved their quality of life. They helped them to reduce standard medication. Cannabis-based medicine or cannabis flowers were well tolerated. They improved in some patients not only one medical condition, but 2 or 3 or 4 different problems and symptoms. The majority of patients preferred cannabis flowers with high THC content, 20, 22, 24%. But we were not able to identify a specific strain that was felt by the patients to be most effective for one specific condition. So the primary aim why we started this survey, we did not reach, but one might speculate it might be that there is not one strain that is most effective in one medical condition, but you also can argue that the study design was not good enough, or the number of patients was too small to find this result. So based on this study, I would say for most of the conditions, you need high THC cannabis flowers to reach a significant clinical improvement.
Mm-hmm. So basically, all this research that you mentioned, we show really benefits for patients, and could actually potentially improve their life and daily activities. They can go to work. We can just enjoy their lives more, of course. And then, but still, the cannabis. It feels like it's being still stigmatized. And it's not that easy also to prescribe it, and you have to go through other treatments, as you mentioned before. It's not first-line treatment. And what do you think needs to change, or do we need more research, or how do you think the future will look like for cannabis-based treatment?
Yeah, so this is absolutely true. Cannabis-based medicine is still stigmatized. And this is particularly true for the use of cannabis flowers. And I think it would be of benefit to have new vaporizers that look more like a medical device, so that for patients it's easier to use and to inhale cannabis flowers at work. Most of my patients tell me that they do not like to use a vaporizer when they are at work, because they fear that this will cause problems. And this seems to be a very important aspect. And then, at least here in Germany, although we are allowed to prescribe cannabis, and this cannabis law was a huge step forward in 2017, we have the problem that cannabis flowers and other cannabis-based medicine can only be prescribed when, and the costs are only covered when you, before prescription, ask health insurances to cover the costs. And this is a very bad situation, because in the final end, it's not you as the treating physician who decides what's the best treatment for the patients, but it's the health insurances who decides what is best, because only a minority of patients is able to pay the cost for this kind of treatment.
And patients are not benefiting from this system then in the end, and we'll have to go for all of these steps. But like, do you think that in future it would be different? It will change, or the stigma will still stay there?
Yeah. So at least for Germany, I would say it needs some time, as always, but the situation will change because cannabis-based treatment is more and more accepted. There are more and more medical doctors who use it. There are more and more medical doctors who are convinced that cannabis-based medicine is safe and effective, and this will change the situation. And I expect in some years it will become a more or less normal medication in Germany too.
Well, let's hope for that. And well, actually, we're almost came to the end, so we have some time for a Q&A section. And just let me open the questions. Second, okay. The first question: how do other doctors in your field of your expertise respond to the use of medicinal cannabis as a treatment?
It differs. So mainly child and adolescent psychiatrists are very skeptically. Psychiatrists are also often skeptically, because they in general treat patients who are addicted from illegal drugs, including cannabis. So it depends, but most experts are open for this, because we have a definite need for new treatment strategies in Tourette's, because available treatments are not effective in all our patients. And therefore, most of the experts are open for this new kind of research, but, and this is understandable, they ask for control trials and they want to see data before deciding for this kind of treatment.
Of course, it's a huge responsibility, so we want to see proof. I want to be sure that that will work, of course. Let's see, one more question, I think, and few others. Okay, I think we have one more question, time for one more question, and the rest will be answered later on. Okay, what is the main difference between use of Sativex and dried cannabis?
It's the route of administration. So I would say when a patient responds to one of these cannabis-based treatments, he will also respond to the other one. It's absolutely rare that I see that someone responds only to one specific cannabis-based treatment. But as explained before, when inhaling cannabis flowers, the effect starts within a few minutes. The effect is much stronger, but it does not last as long as when using oral cannabis preparations. So this is the main difference. And as it explained before, most of at least my patients prefer to inhale cannabis because they tell me it's much easier to find the correct dosage and to avoid overdosing when inhaling because the effect starts within a few minutes. Mm-hmm. But I also have patients who prefer oral medications and they are familiar with this, they use it, they can also avoid overdosing. So I would say it also depends a little bit on what patients prefer.
Mm-hmm. Of course. And do you see that there's some kind of effect of terpenes and flavonoids in the cannabis flowers that also work for Tourette or tics? Yeah,
so this is a discussion that is still ongoing, I would say, yes. But it might be that patients prefer cannabis extracts and cannabis flowers because of these further ingredients. And as mentioned before, we started our research and our treatment using pure THC, and there's only a small number of patients who still decides using pure THC, and this might be because of these additional effects of CBD, other cannabinoids, but also other ingredients. But there are no studies who compared the different cannabis-based treatments so far.
Yeah, of course, we need more look into that, of course. And Professor Müller-Vahl, do we have one more minute for a question?
Yes, yeah, definitely.
Sure. Okay. What's your experience regarding cannabis flowers dosage with the Tourette's, microdosing or a bigger dose?
So it depends. So this is similar to other indications, but most of my patients have a daily dose between 0.5 to 1 gram per day. So it's a medium to high dose, but I have some patients who have low dosages, and I have a few patients who use really high dosages up to 2 or 3 or even higher gram per day. But these patients are mainly patients who used cannabis without supervision by a medical doctor. And this is something we know quite well, that without a supervision by a physician, patients often up-titrate more and more. And then in the end, they have these high dosages. Mm-hmm. But on average, it's about 0.5 to 1 gram per day.
Okay, well, so it's basically also quite personal for each patient, and yeah, that's also makes it more difficult to prescribe for a doctor, because then you have to really look into that. Okay, well then thank you very much. I think that was the rest will be answered later. Thank you very much. We were really honored to have you here, and well, yeah, hopefully we'll have one more session later on.
Thank you so much.
Thank you so much. And everyone who wants to share this video or rewatch it, it will be available on YouTube. And thank you very much for joining us for this lunch webinar, and see you next time. Thank you. Bye-bye.